Hello, I am Dr. Marilyn Faye-Gaucher, and welcome to the second episode of our health series. Today, I will be interviewing Mr. Roland all the way from Ohio, United States, who recently contracted COVID-19 and treated himself while being quarantined. Let's find out what he did at the primary level to treat himself, shall we? Mr. Roland, welcome to this series. How are you doing today, sir?
I'm doing great. How are you?
I am fine. I am very well, but thank God. I just want to thank you again for accepting to join me on this journey and giving me the opportunity to talk to you a little bit concerning your recent experience with the coronavirus. How are you feeling overall?
Right now, I am doing 100% fine.
Great. So happy to hear that. So now tell me this. You recently had the virus. Can you please tell me a little bit, like when did you get the positive test?
It's a long story, but I'll cut it short. Okay.
Mm-hmm.
So it was actually on the 2nd of this October, 2020, that I was tested. 24 hours later on, I got the result positive. I'm like, wow. So my name finally will be added to the millions that I see every day. I'm like, okay, I'm here.
Yeah. But prior to that, did you experience any symptoms at all?
Oh, yeah, yes, I experienced some symptoms.
You mean prior to getting the positive test?
Yes.
Can you please tell me?
Actually, first I am a jack of all trades, master of none. So, I work so hard. So some of these symptoms, they are natural, they are normal to me, especially if I do like 16 hours job for 2-3 days. I don't sleep, I have to go to school, I have to do some stuff. Actually, if I don't sleep, normally I have stuff like pain, I have headache and stuff like that. So prior to that, I got some muscle pain. Then I also got a little bit of cough.
Mm-hmm.
Then I was also nauseated a little bit. That's just prior to the test.
Prior to the test. Now, let me ask you this. Can you please describe to me and to the audience what was your lifestyle? I understand that you work very hard. What were you doing prior to you getting tested positive? What were you doing as a preventive measure?
Oh, since March, as the state was being closed, was being shut down, we have been having a lot of videos, people coming up telling us how to prevent ourselves in order not to get sick, because the rate at which people were getting sick, it was just alarming. And so I'm from Africa, and as such, we have our own type of things that we do that will eradicate our headache. It will eradicate our pain. It will eradicate a lot of stuff. Flu, it will eradicate it. And when this virus thing was all over the place, people, including your mom, they will call me like, Roland, you always eat fruits, right? I'm like, oh yeah, my kids, they don't really eat vegetable that much, so we dwell mostly on fruit because it's sweet. Right. Anyway, so she said, what are the type of fruits that I eat? I'm like, well, pineapple, pawpaw, apple, grapes, and so on. She said, very good. And she asked me, what do I do with the peelings? I'm like, what are you talking about? I throw it away. She said, that's good. She said, I henceforth I should not throw it anymore.
Now,
I'm
is
like,
this before you got tested positive or after?
this one, I was doing it like in March, April to
Mm-hmm.
prevent myself from the coronavirus. But just as I said, my lifestyle became challenging. I did not have time for that shit anymore.
Okay.
So before I got tested, I was not doing those stuff anymore.
So, no, can you please specify again what you're doing with the peelings? You talked about some peelings
Yeah,
of some fruit.
that was things in March though, like March, April, and May of this year. I will put these peelings inside a pot, and I'll add some grapes, lemon, and then I will cook it. First, I have to really clean it though. Then I'll cook it. After I cook, I tell you, I consume the water. I'll drink it, and since it's from fruit, it's not bad. It is sweet. So I'm like, I'm going for it.
Mm-hmm.
And so as such, at that time, that was like my own tea at home though.
Mm-hmm.
That's what I would take a cup of it in the morning.
Mm-hmm.
At night, I take a cup of it.
Mm-hmm.
And that time too, I was very, very okay.
Right.
But things became hard for me. I did not have time anymore. So I backed off.
Right. So let us be specific again. You had pineapple. You said pineapple peelings,
Yes,
orange peelings.
orange peelings,
You said
pawpaw,
papaya. We call it papaya
papaya
peelings.
is
Mm-hmm.
I got papaya peelings.
Mm-hmm.
Then I got lemon,
Lemon peelings.
watermelon too.
Watermelon peelings. Okay.
Yes.
So you boiled all of this in a pot.
I put it in the same pot.
Mm-hmm.
Then I added some natural herbs, which are what we eat every day,
Mm-hmm.
ginger and garlic.
Ginger and garlic. Okay.
Not their peelings this time around. I just bought ginger for like $1, garlic for like 50 cents,
Mm-hmm.
and I wash it and I just throw it in there.
Mm-hmm. So you would boil this and then you would drink the liquid as a tea, as a form of tea, morning and
Drink it
evening, or how often were you
in
doing it?
in the morning and in the evening.
Okay. This
Then
is part.
even at times, if I'm just feeling sleepy, instead of me to like go get a cup of coffee, I
Mm-hmm.
just go to the kitchen and I warm up some, and I'm good to go.
Okay. So you started doing this in March when the lockdown started, right?
Yes, because I was scared. I didn't want to get
Right.
sick.
Right. What were you doing, the social distancing and the wearing of masks as well?
I was doing all those stuff, but it is not my thing. At times, I will hide and I will pull down my mask a little bit, to make me breathe very well. So I did not really like it,
Yeah.
especially
Normally,
when going to the public though.
right. Normally, you should wear your mask whenever you are going to the public. If you're just at home, you don't need to when you're just at home.
Exactly.
Yeah, but when you're public, you don't know who the next person is if they have the virus, so you want to make sure that you have your mask, right? So, but you did make mention that at some point you got tired of doing it, the regiment.
Yes.
Okay.
I mean, even to eat food, it takes time, right?
Mm-hmm.
Yeah, then I mean, like, to go get this fruit stuff, always come and clean it, boil it, that's time wasting though, which is just a little bit of time.
Mm-hmm.
But I got tired. That's just it.
Yeah. So do you kind of remember when you got tired of doing
I
it?
got tired, I can say in April. It
So
started in March, so I just did it for like 1 month. And in April, I'm like, and again, it was because of all these kind of videos that I was just getting, like, black people do not get the virus. It is so hard for black people to get the virus, things and stuff like that. So I'm like, okay,
you're black.
yeah,
So
I'm
you're not gonna
black
have the
from
virus.
Africa.
Right. So that was your belief then.
That was my belief at that time, so I stopped it.
Right. But even though you stopped the regimen, you were still wearing your mask though.
Oh
And
yes.
social
I mean,
distancing.
actually, here in Ohio, they won't let you go into any shop without your mask. They won't let you in school, in short, any place public without your mask.
So, unfortunately, you contracted the virus. Do you know how you contracted the virus?
100%. So, what happened is, it was not only me though that contacted this virus. A bunch of Cameroonians had this virus at the same time. We went, I always tell people that there's no life after this. Don't work all the morning and you say, I want to work now and I enjoy when I'm old or I enjoy in the future. You have to enjoy your money right now. Not even your money, enjoy your life. So whenever there's a party, man, I don't miss. Like, Mr. Roland, are you coming? I'll be there. Anyway, so we went to this party. I went to this party innocently, do what we usually do in parties. But I want to tell you that in that party, there was no single soul. There was not a single soul with a mask. All of us were from Cameroon, although some few whites were there, but 98% of us were from Cameroon. We had no mask. We would chat. We don't know where, I know where some people live, but I don't know their lifestyle. I don't know whom they chat with when they are not with me, things and stuff like that. So normally in the party, what do? Once we meet, first of all, we hug, we greet each other, we kind of like, how was your day? How was your week? We chat, eating, drinking, dancing, and then we go. So on that blessed Sunday, after the party, good, came back home, Monday, Tuesday, and it was my wife that said, she does not really feel good though. I'm like, wow. Anyway, so she was to go to work the next 2 days. So I'm like, since you are home, just go to the hospital since you said you are not feeling good. What are your symptoms? She's like, oh, she got this pain all over her. She's nauseated. She got this cough. I'm like, okay, just go, since we have tried our normal cough medicine in the house, which is, what do we take again for cough? I'll tell you in a minute. So she tried what we always take, and it has been helping. So she tried it for almost 48 hours, Robitussin, that's the medication. So she tried for over 48 hours and there was no improvement. So she went to the hospital or to see the doctor or to an emergency care. And, so they tried to interview her, ask her some of these more symptoms that she was having. And they were like, okay, we'll give you medicine for pain and for cough, but these are all signs of coronavirus. Why don't we test it? And she was like, okay, let's go. Call her insurance. They said they'll cover it. Good. So she got tested. That was on a Wednesday. Then on a Thursday, her result came positive. Wow. At that time too, I started thinking about my own life. I'm like, wow, I was thinking that I'm feeling this headache or this pain because, I was up all night studying. Maybe it's not just from that studying. My wife has been tested positive. So I think me too, I'm having cough. First, I was trying to accuse her that she gave me her cough. Little did I know. Anyway, and so she asked me if she gave me the pains too. I'm like, my pain, I'm sure, is from my job, from me staying up all night. Anyway, to cut a long story short, I said, let me go get tested too. And behold, they called me like, Roland, can I talk to you? I'm like, wow, you guys call me. Can we talk? I'm like, okay. I have your result here and you have been tested positive.
Mm.
Like I can see myself sweating
Mm.
just after that information. I'm like, okay, thank you. And right away from there, just 10 minutes later, I started having calls from here and there from the health department asking me, isolate yourself. Are you in any pain? Are you having shortness of breath? Asking me all those type of questions. And since I told them I did not have any shortness of breath, they were like, thank God. That please, where do you live? Do you have a safe place to isolate yourself? I'm like, yeah. So they said, please let me take off 10 days, no contact with anybody. And so that was my life. I have to call friends to please go and do my own shopping.
Mm.
Something I've never done in my life.
Yeah.
I'm that kind of guy whereby I will, just go.
Yeah. So you
And
and your
so
wife stayed in the room. You guys quarantined yourself for 10 days?
we quarantined ourselves for 10 days. And I couldn't see myself getting really sick. If I say getting really sick, I couldn't see myself sleeping when I'm not supposed to sleep. I couldn't find myself like going to the hospital to be one of those people that have been saying on the TV how they are struggling for their own lives.
Mm.
I'm like, nope, that's never my portion.
That's good. So your mindset switched, right? You had a positive mindset. You were not going to let the virus to.
My goodness, right away. And as I've been listening to all these videos from you guys, even you, I'm like, okay, I have to take into consideration what you guys have been saying. And so I have to go back to what I started before. This time it was in full gear because I did not just want the virus to go more than where it was.
Right.
I did not want it to touch my lungs at all.
Good.
I mean, I got a family to take care of, so I did not just want them to suffer if I was in that kind of state.
And you do have 3 children with
I
you.
got 3 kids with a wife, with a bunch of siblings.
Right, right.
Even with you talking, I mean, I got you guys, friends, relatives. They are just too much.
On you, right?
Yes.
So, can you please tell us exactly now that from the time you got the virus to the time that you got another test, right? And you got tested negative, correct?
Yes.
Okay, so what exactly?
No, I'm sorry, no, sorry. I haven't gone for that test yet. Actually, this company said the virus has to be in me for 90 days, but it will lie low. That I can be tested positive after I have no symptoms, nothing. After I've gone through my quarantine, I can still be positive. So they are not 100% sure I will be negative. Okay. But if I feel like any of those symptoms, let them know.
Okay. Okay. So can you please let us know exactly what you have been doing from the time you tested positive up until now?
All right. I was being told by my parents that a problem shared is halfway solved. Immediately when I got my result, I asked for them to email to me the paperwork. They did. I posted it to my sisters here in the States. They started crying. I'm like, crying for me? Why? I mean, I'm fine. Guys, don't cry. I just want to let you know that this is what is happening. Immediately, they helped me out with finances. They say, oh, we know you will be back home. Take this money right now. Do this, do this, do this. What did they ask me to do? Go back to what I was doing in March. Get more fruits. This time around, I shouldn't even bother to even clean the fruit. I can get like a pineapple. I can just slice it and I just throw it in the pot. If I don't have the energy, I'm like, please, I have energy, and my kids will still need this fruit. So anyway, so me being whom I am, call some people, please go buy me fruits. They did. And Dr. Emelda also sent me fever grass. I don't know the scientific name of that grass even though.
Lemongrass?
Lemongrass. She sent me some right from Maryland. That lady, may God bless her. Like she posted it overnight. Within the next 24 hours, fever grass was right at my door.
Awesome.
Mommy Emma from there, she bought something lemon too. This one was from Amazon in a bottle. Wow, that one was really powerful.
That's the essential oil, I think.
Yeah, my goodness. I mean, may God help me to bless those people. So with the fever grass, put in a pot, get all those fruits again, their peelings, because I'm a little bit stingy. But this time around, I was not stingy while cleaning the fruits. Like a big pineapple, I'll get just a little bit of it at the end of the day. The peelings, put this time around, it was a big pot though. I got a bigger pot.
Because now your feed is for you and your wife, right?
Me, I said not only me and my kids, my whole household. So after 2 days, Dr. Marilyn, I was cooking this medication. Brand new cook. Because for a reason that I don't know, my kids fell in love with it. Maybe because I was drinking it constantly. I don't know. They too were just drinking it. I'm like, don't you guys hate it? Yeah, Daddy, it doesn't taste good. But because you are drinking, I can drink it too.
Oh, good kids.
Anyway, so my wife was there thanking her own. Like, I asked myself if this thing was a diuretic, because I was going to the bathroom like every 2 hours. But anyway, with pineapple peelings, pawpaw peelings, watermelon, lemon, put them in a pot, cook it, and I just put just a drop of that ointment that Mommy Emma gave. Just a drop.
And this is the lemongrass essential oil?
The essential oil. I just put a drop there. Just a drop. It doesn't taste good though. It doesn't taste good. So I just added that with the fever grass, which makes it more like the tea that I was drinking from my grandparents back home. The taste of the fever grass. So what did I do? If I cook it, I extract my water or the liquid portion. I put it in a gallon or in a container. I have to tell you that I have like 10 liters of liquid of it. 10 liters. Put it in the refrigerator. Then, since I said I have a lot of things to do, even while on quarantine, I have a lot of things to do. I will not just stay home. I'm sorry. I will not just stay in a room. This would be a perfect time for me to fix my house, do some painting around, renovate things and stuff like that. So I did not want this sickness to put me down for a minute.
It's a good thing you mentioned that, because from knowledge, this virus tends to make you want to be sleepy. It like makes you very weak. Want to sleep.
I was fighting it, my dear. The thing was beating me up, so I have to fight it. Yeah. I don't just want to sleep when I'm not supposed to sleep. I'm not supposed to sleep for more than 6 hours in a day. No, that's not me. I haven't done that for like 30 years. So why should I sleep for more than 6 hours in a day?
So did you add ginger? Did you add ginger and garlic? Or
I added ginger and garlic. Oh, I always add ginger and garlic. As I said, ginger I don't peel it. I just slide it. Throw in it. But with the garlic, I do peel it though, because the outside, because the shell of it is like dry. Yeah, so I try to peel it.
Yeah.
And then one thing I also did, which I was being advised by Uncle Bison, was husband to Dr. Emelda, advised me to cover up myself with that same medication, that I should do the covering How do I do that? I have to first take out what people will drink orally. Then if I begin the covering therapy, nobody should drink it again, because with that one it is already dirty. So after I took out, let me say, the first grade of juice from my concoction, I'll now put these hot peelings, which I have heated it up. I put it in a pocket, take it to the bathroom, take a blanket, cover up myself together with this medication or this concoction. Then I take a stick, I begin stirring. What comes out of it? Vapor. And as it's coming, at times I open my mouth, I am inhaling, and I can really feel some hot air getting into me.
So it's getting into your lungs.
Getting into my lungs.
Right.
So I did this therapy. I will do it for 6, 7 minutes or 8 minutes for a day, or at the time I'm trying to do it, or can I say at a time, I'll do it for 6 or 7 or 8 minutes. And since this medication is too hot, because it's directly from the fire or from the stove, man, I couldn't bear it. So at times, I try to come out of the blanket. I come and get some fresh air, just for like 20 seconds. And I tell you that during this moment, I'm sweating a lot. A lot of sweat is coming out from my body.
Mm-hmm.
I did this therapy 2 times in a day for about 4 or 5 times, if I'm not mistaken.
4 days. 4 or 5 days. Okay.
Yeah, 4 or 5 days.
Mm-hmm.
And I was just doing this thing because, as I've told you earlier, I don't want to catch that virus. I was born free, so I wanted to be a free man, not being a prisoner in my own house. So I was doing all of these things so that even if the virus was still there, let it just go back where it's coming from.
Right. And again, the main idea is you want the virus to be, the effects of the virus to be halted or dismantled before it getting into your lungs, right? You don't want it to get into your lungs.
Before it get into my lungs, my dear, before it get into my lungs. That was just my prayer.
Yeah. And you know what, from what I've heard that, going through the whole system whereby you're taking in oxygen at the hospital on a ventilator, it's the worst experience ever. So for people that thinking that, oh, they may not be able to stand the heat, or they don't like to put on a mask, what advice would you give to them?
My goodness. The first thing is, this concoction that I did is really cheap. With $10 to $12, you can make this concoction. In addition to that, you will still eat the fruits. So to me, what you really buy for which you don't really need, I can say maybe it's the lemon.
Mm-hmm.
Hospitality, as we first of all know, America, I don't work in the hospital where these patients are being treated, but I deal with the patients too. And at times I ask them questions. They tell me, at times you go to the hospital, I'm so sorry to say this, we know that it doesn't happen in America. Yes, but it happens during this coronavirus. The doctors, they pick and choose who to cure in the hospital. Yes, reason being that they said ventilators were limited.
That's true.
So it's just like maybe they can see me, maybe being a young man, and maybe they see an old man, they might like, let us do this young guy first. That's just the way I'm thinking. But we know that's not how America is, right? Yeah. That everybody needs to get the medical treatment equally.
True.
But my wife said, when they come like that, first, if you are not really, really sick, they send you back home. And then
they send you home and they tell you to quarantine yourself for 14
tell you to quarantine yourself. And then even while at the hospital, my dear, the trauma that you go through, it's like before people come to your room, even before a doctor comes to your room, the doctor will stand like 10 feet. They want to give you a medication, they will have to put it, maybe attach it somewhere, and then they just come and put and ask you to come and get it. They come to give you food, they come and put it somewhere, then they push it into your room. Like, I mean, you have all those depressions.
Yeah.
Some people will say, no, I better go home and die rather than staying here and I've been treated as an outcast. That's the way they treat these patients in the hospital, for which, I mean, I've seen some. When I was doing my clinicals, I seen some children that I did not work with them, but my instructor took me into the room. We all dressed up, my dear. It's not that easy. So my advice is, this style, it is cheap, and you must not really do what I did though. Like you must not make that water to be, or to the medication to be really, really hot. That was just me, because I needed this thing to go out ASAP.
Yeah.
People told me that if the water can even still be 70 degrees, it will be okay. But mine was more than 100 degrees.
And the main idea is the effect is the vapor, right? The very hot vapor coming out of the water, you inhaling it, and it's going into your lungs and doing what it's supposed to do, right?
Doing what it's supposed to do. I mean, but again, at the same time, I say we do eat hot food, we drink hot coffee, we drink hot tea. Then I see no need why people will be scared with that kind of stuff.
Yeah. Yeah, it's easy. It's better to do that than to put yourself in a position where it gets worse and then you have to be rushed to the hospital. And that's the main reason for this series that I'm doing, is to get other people's point of view, what they've gone through, what they did to take care of themselves, so that the main idea is to share the knowledge. Hopefully somebody that just got infected with the virus that has to stay home for 14 days can listen to this and get some information that they can apply, and it'll work for them, so that it doesn't get to the point where they have to go to the hospital, right? So
yes.
what advice would you give for anyone who is still thinking that this virus is not real, that they're not taking it serious?
The first thing, let's follow the FDA advice. I know at times it's difficult to stay 6 feet apart from your loved ones, but let's try to do that.
Yeah.
It is really, really important and crucial.
Yeah.
Then secondly, the mask, please. Mask yourself apart from your house, anywhere you are going to, even to visit your own brother or your own sister that does not stay with you, please put on this mask.
Yeah.
And Dollar Tree sell like 12 masks for $1. So this thing, I even go to some shops like Walmart, in front of at the door, the thing is there free of charge. You can grab 2, 3, 4, 5. Nobody will even say, hey, why are you doing that?
So would you advise any gatherings?
Being Africans, I will say, well, we know family is so important to us. I can say yes, I will still advise gathering, but let it not be that kind of crowd. Not too crowded. Number 2, if it's like 10 people, 10 people in a big living room, stay apart still.
Yeah, because that's what the health officials advise anyway. They do advise a minimum of 10 the last time I checked, right?
I mean, we should not, we still have relatives, we still have friends that we need to visit. We should visit them, but keep a little bit of distance, and then mask yourself. Try by all possible means, when masking yourself, don't leave your nose, because you still inhale through your nose. From your nostrils right to your mouth, let it be covered.
So would you also advise for people to do the steam inhalation even if they're not tested positive, just for protection?
My dear, do it. As I've said earlier, this thing is free. First, what I still do, although I haven't done it, but I will still continue it. My next concoction that I'm going to cook, I will still do my steam stuff.
Yeah.
After I've taken my juice away, I will still use those peeling, put in some more water, warm it up, boil it up some more, and I will steam myself. Because at the same time, it's not only the virus, the COVID-19, which I heard there's COVID-20 now, that I'm protecting against right now. I'm protecting against any viral infection.
Yeah.
This is the flu season, right?
Mm-hmm.
People still get the flu. With that, I bet you, my dear, you will go flu free. You will go headache free. Those are just, I don't know how, I am not a scientist, but I'm very, very sure inside me, all of these medications that we take, part of this concoction is inside.
Yeah.
It's just that it has been regulated. Maybe, at times, like my kids' style and all, they will say, oh, this one is like orange juice. This one is like grape juice. And you actually see the grape behind it. It means some grape is inside that it means some grape is inside that medication.
Right.
Just that we are just doing the whole stuff. We don't like regulate it as scientists do to come out with our various medications.
Yes. You know what you just said, I would like to add something to that. When it comes to, traditional medicine, the FDA has to approve any medication. I'm a medical graduate, and from knowledge and based on my experience, medical doctors are trained to not only diagnose and treat and treat a patient, but the treatment has to be approved by the FDA. Okay, and the FDA, obviously, before the FDA approves any medication, it has to go through, the clinical trial process, and has to be, it has to be tested and proven to be efficacious when it comes to treating a particular disease on a patient. Now, if it is not approved or tested and approved when it comes to the whole science process, then the FDA will not approve it. And so that is the main reason why we've been waiting up until now for, a real good drug that is tested and approved for COVID. Regeneron and I think that's the medication that has recently been approved that was given to Donald Trump. However, it's still not out in the public, like officially, right? So until then, what can we do? What can we do as individuals, right, to take care of ourselves? What can we do to prevent getting sent to the hospital because it has reached our lungs? Obviously, there are alternative medicine out there, the concoction with the ginger, garlic, and all the other supplements that you add to it. That's one good thing. The wearing of the mask is very important. Socially distancing ourselves from crowds is very, very important. So I really, really want to thank you for this opportunity. I thank you for your time. I know you're a very busy man. And I really, 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 really appreciate the fact that you took time out of your busy schedule to talk to me, to talk to us, to the community, and share your experience when it comes to this COVID-19. Is there anything else you would like to add?
Oh, I first of all want to also say thank you for trying to grab information from us that we have been tested positive and we came out of it, now to share our experiences and to advise others. Thank you very, very much for that.
Thank you.
Then for those folks that are in the hot areas where they have like this guava too, this is funny. The guy that I sent to buy me fruit brought guava. My wife haven't tasted guava for like 15 years. She took the thing and ate it. Anyway, if you have guava, cut it, slice it, and put it inside. Even if you have the young leaves of the guava, even of pawpaw, put it inside still. That is what I know it was being used by my parents back home.
Right. And the pawpaw, you're talking about papaya, right? Papaya leaves.
Papaya leaves. Yeah. The younger ones, though, not the matured ones.
Yeah.
those that are still very, very young, that are still shooting up.
Yeah.
Put that too. If you have it,
Mm-hmm.
even those like in Cameroon, you will always have, you have this stuff around you.
Mm-hmm.
But I know in America here, it's kind of scarce to get it.
Yeah, maybe the farmers market, this international farmers market, we can find them there, right?
Yeah, but I mean, I didn't use it, but it worked for me.
Mm-hmm.
Yeah.
Yeah. Well, thank you so much. I know you have to rush to go to work. I really thank you again for your time, and hopefully next time we'll be having a conversation about something else.
No problem. I'm always available. Just let me know. I
Yeah.
will make up my time for you.
All right. There you have it. I hope that you learned a few things that you can implement at a primary level to prevent the progression of COVID-19 if you're tested positive. If you do know anyone who has the virus and is being quarantined, I plead you, please share this video with them. It is worth emphasizing that the aim of these interviews, is to prevent the progression when it comes to the mobility and mortality that we are now experiencing at a global scale. So you can play a part by just sharing this video and any other videos that I do drop related to COVID-19. In addition to sharing, please do subscribe and press the bell notification so that you will be notified as soon as the next video is posted. In the meantime, take care of yourself. God bless you and take charge.